Hello, today we're going to start Chapter 15, Endocrine, Nutritional, and Metabolic Diseases in our Coding Handbook, which corresponds to Chapter 4 in our ICD10 CM Codebook. This chapter includes diabetes, which is probably one of the more common diagnoses you're going to see in the hospital. So we'll spend quite a bit of time talking about diabetes and the different manifestations of that. As a reminder, as you go through the Coding Handbook, you're going to see several examples of procedures coding. Just ignore those. As we've talked about in the past, just as a reminder, ICD10 PCS is taught in HIT220.221. It's a different code book. It's a different format. It's a totally different language, if you will, that you're learning. However, if you decide you do want to become a coder down the road, you are going to have to know ICD10 CM, which is this course, ICD10 PCS, which is HIT221, and the CPT book, which is HIT241. All three of those languages, if you will, are on the CCS exam. So just as a reminder there. As an overview of the types of diabetes that you're going to be coding, type 1, it's often called juvenile diabetes, but it really has nothing to do with the age of the patient. This type of diabetes is characterized by the body's failure to produce any insulin. So we do not add the code Z79.4 for long-term use of insulin for patients with a type 1 diabetes because they need that insulin to stay alive. So we just assume that they are getting that insulin, and it is not coded with a type 1. Type 2, the body is producing insulin, but it's not enough, or what it's producing is not sufficient in quality to be able to manage the glucose in the body. So those patients need the insulin, and that's when you're going to use that Z79.4 code. Be mindful that we do not use the Z79.4 code if the insulin is being given temporarily. Like if someone who's normally not on insulin comes into the ER with a really high blood sugar, the doctor may order insulin just to bring that sugar down, but we're not going to code that unless that insulin is prescribed. When we start looking in the alphabetical index for types of diabetes, we're going to start with the first axis being the type, and then underneath that in the alphabetical index you will see the different complications or manifestations. Diabetes can cause many different things at the same time. Some can be acute, some can be chronic. So it's not unusual for a diabetic patient to have many E codes. Assign as many codes as you need to identify all the conditions that that patient has. There is such a thing as secondary diabetes, and that's when it's been caused by another condition or an event. Very common to see that in infections or when the pancreas is removed. When we get to nutritional disorders, as a reminder from our previous lectures, the BMI, the body mass index documentation, can be obtained from dietitian or other provider notes, and that is an exception to the guideline that requires all documentation be based upon physician documentation. Fluid overload is another one of those terms you often read in the hospital, and you're going to code that based upon what causes that fluid overload. If the patient is in congestive heart failure, we do not code fluid overload because that is a manifestation of congestive heart failure and what you often see, just to know how to diagnose that. Okay, let's look at some of the exercises. 15.1, number 2, and this is a secondary diabetes due to pancreatic malignancy and snowflake cataract. I had not heard that term, snowflake cataract, so that was a new one for me. The cataract in this case is a manifestation of the diabetes. So you know from our previous chapter 29 how to code that pancreatic cancer. You're looking in your table of neoplasm. Under neoplasm you have pancreas. Then in the malignant primary column you have C25.9, and it is your primary diagnosis. And then the diabetes, we're going to look in the alphabetical index here for how we would find that code. So let's move to our alphabetical index. And we are in diabetes. And we're going to move down to due to underlying condition. So we keep going down, and here we are, due to underlying condition. Now there was another due to up here, so let's don't get confused. The first due to is drug or chemical. So we're going to keep moving down to get due to underlying condition. And here we go. And if you're wondering why are we coding due to, it's because the patient has the cancer. And the documentation told us this is a secondary diagnosis due to the malignancy. So that's why we're going to diabetes with the subterm due to underlying condition. And there's a cataract here, E08.36. So that's our diabetic cataract code. When we go to the tabular, E08.36, diabetes mellitus due to underlying condition with diabetic cataract. We are in the E08 category, so we always want to go to the top of this category to see if there's any instructional notes that we would use in this category. And we get up to, let's see, need to go to the next column. Here we go. Diabetes mellitus due to underlying condition. Code first the underlying condition. And you see malignant neoplasm is one of those conditions. So this helps us to know how we sequence those codes. We're going to code first our malignancy and use an additional code to identify any insulin use. So let's see if our documentation gave us any information on that. In our documentation, it doesn't mention the insulin use, so we're not going to code that. But we are going to code the malignancy first, as instructed by our instructional notes. Many times when you don't know how to sequence your codes, your instructional notes really help you with that. Okay, let's look at the next one. This is exercise 15.1, number 7. And I wanted to use this one just to have you be mindful to always use the more specific code. If we look up impotence in our alphabetical index, we get the N52.9 code. 0.8 and 0.9 are both more non-specific, or not as specific, I should say, as the characters 0 through 7. So even though the alphabetical index gets us in the neighborhood in the tabular, you always want a more specific code if you can find one. And because we know that impotence is a male sexual dysfunction and erectile dysfunction, we could look at it this way, looking up dysfunction, sexual, male, erectile, each one of those subterms. And then under erectile, there's a due to, under that, disease classified elsewhere. That would be the correct code and the more specific code, because we know that his impotence is due to the diabetes. And when we go to N52.1, there is an instructional note, code first, underlying disease. Then our diabetes type 2 with neuropathy, E11.40. So let's look up, first of all, just to show you the importance of indentations, as I often have in this course, I want us to look up this dysfunction in the alphabetical index. Okay, we're in the alphabetical index, dysfunction, sexual, here's female, let's look down to find male, here's male, we're looking for erectile, here's erectile, drug induced due to, disease classified elsewhere, N52.1. So that is the more specific and I believe the more accurate code in this case. So let's look at the E code. Remember just a few slides ago we talked about diabetes being the first axis is the type. So when you're in your alphabetical index, here's your diabetes type 1. You're going to move down to find diabetes type 2 with neuropathy. With neuropathy, here we go, E11.40. So let's look that up in the tabular. In the tabular, we're in E11.40, type 2 diabetes with diabetic neuropathy, unspecified. Unspecified means that you see these other terms, mononeuropathy and polyneuropathy. In our documentation, it didn't really specify that, so we have to use the unspecified code in this case. Exercise 15.2, number 4. A type 1 diabetic developed hypoglycemia, which is a low sugar, even though she had taken only the prescribed dose of the insulin and she did not alter her exercise or her eating regimen. And if we coded this, it would be diabetes type 1 with hypoglycemia. One reason why I wanted to use this particular exercise is we're going to see a little bit later, depending on if the insulin is too much or too little, you have either an underdosing or a poisoning. But in this case, the patient, the documentation tells us the patient took only the prescribed dose. So there is no underdosing and there is no poisoning because of taking too much. So you're simply going to code the diabetes type 1 with the hypoglycemia. The next exercise, 15.3, number 9, deals with a morbidly obese patient with a BMI of 39. And I have here the rationale and the pathway for how you would get to those codes. As a reminder, we can use BMI documentation from a dietitian to help us know what we can code. Exercise 15, number 11, is a fluid overload due to a transfusion. You may remember in an earlier slide in this podcast I talked about how you code fluid overload depends on the circumstances. And in this case, when it's due to a transfusion, it falls under the E87.71 code. Exercise 15.3, number 3, has congenital myxedema. That's pretty straightforward, but this one, the inappropriate antidiuretic hormone secretion syndrome, is a little more challenging. So I wanted to show you the pathway. When you are looking this up in the alphabetical index, antidiuretic is your main term. That's a tough one. And you see here in the alphabetical index, there you go. I know when I first started looking for this term, I was using syndrome as my main term, and there are no entries under syndrome for antidiuretic hormone. So then you just start looking other places, and I fortunately I looked under inappropriate, there was nothing there. But then when I went to the next term, antidiuretic, I did find it. So sometimes you just have to look around and try all the different terms until you find the term or terms that describe the condition. If the record did not state the type of diabetes, there is a default, and that is in one of our coding guidelines that I've quoted here. If the type of diabetes mellitus isn't documented in the medical record, the default is E11.type 2. Of course, the dash meaning additional characters may be needed. Something to always keep in mind in a good test question. Okay, here's an example not in the coding handbook that relates to the underdosing of insulin. The patient was admitted for treatment due to complications from type 2 diabetes, which include diabetic polyneuropathy and proliferative diabetic retinopathy with macular edema. The patient was using an insulin pump at home. However, she told the physician it had not been working correctly for some time, and she found out this morning from a service technician the pump was not delivering the full prescribed dose of insulin. So what this patient has described is an underdosing of insulin, which is a mechanical failure of that pump. And we have a guideline specifically related to complications due to insulin pump malfunctions. Underdose of insulin due to insulin pump failure is an underdose assigned to a code from subcategory T85.6, which is mechanical complication of other specified internal and external prosthetic devices, implants, and grafts, that specifies the type of malfunction as the principal code. So that's telling us right away that's our principal, followed by the code T38.386, underdosing of insulin. Additional codes should be assigned for the type of diabetes and any complications due to the underdosing. Let's look at how our pathways would look for this particular case. There is a column in the table of drugs and chemicals for underdosing, and we would look up insulin as our substance, and here would be your underdosing code. So that takes care of that T38 code, and we would add the sixth character A for initial encounter. Our documentation tells us this is an initial encounter. But this T85 code, we need to find that one, and that is found in the alphabetical index under complication. Insulin pump, mechanical, breakdown gets us to T85.614A. The underdosing code we have here below, T38.386. We know this person has diabetes with polyneuropathy. That is an E11.42. With retinopathy proliferative with macular edema, E11.351, and is on insulin. Then here's the same case, the very same case, the same diabetes, only this time an overdose of insulin is considered a poisoning. Underdosing is when she's not getting what was prescribed. Overdosing is when she's getting more than prescribed, and that overdose is considered a poisoning. So you're going to go back to that T85.6 code. This time your T38 code is a poisoning code, not an underdosing code. And then of course your additional codes assigned for diabetes and any associated complications. This shows us, for that particular case, the pathways. This is another exercise not in the Coding Handbook. Patient had a total pancreatectomy last month, and as a result has now developed secondary diabetes mellitus and uses insulin. We have a guideline that speaks directly to secondary diabetes mellitus due to a pancreatectomy, and it gives us our 89.1 code here for post-procedural hypoinsulinemia. My goodness. You assign a code from E13 for your secondary diabetes and the Z90.41 code for acquired absence of pancreas. Of course, it mentions she uses insulin, so that's our Z79.4 code. So whenever you see documentation that talks about a total or a partial, it's a different code, total or partial pancreatectomy, you're going to be reminded of this coding guideline. This gives us our pathways for how we would work through that problem. Note that there is an instructional note below the E89.1 code that tells us to use that Z90.41 code for the absence of the pancreas, acquired absence, meaning the patient had it removed, and then our post-pancreatectomy E13 code and our insulin. Secondary diabetes comes under the specified type code for diabetes, which is E13.9. Here's our insulin, and here's our absence of pancreas. The exercises in this PowerPoint do not address all the guidelines for Chapter 4. Exam questions may relate to all the guidelines, so be sure you cover everything in your code book. And always follow your assignment schedule with regard to any specific chapter assignments. If you have any questions, please post them in discussion board, and I'll try to answer them from everyone.